Hello everyone, welcome back to my YouTube video channel. Today I am so excited to have an honor to have a conversation interview Dr. Edward Zuckerberg. Everyone know him. He is the international lecturer and national lecturer in technology, and he's a pioneer in the integration technology in dental office, as well as the delivering painless dentistry for more than 30 years. And I'm so happy to have him join me on my YouTube channel, and I'm hoping to bring you guys some uh, different topic today. Dr. Zuckerberg have been heavily involved with the Keystone Biotechnology company, and he's going to share with us the latest information about uh, gum disease, P.Gingivalis bacteria, and how it become a major problem for our entire whole body. And without further introduce, I'd like to have Dr. Zuckerberg say a few things about what the latest news and how we can go about this conversation.
Hey, how you doing? Nice. Thanks for having me on the show. Okay.
Thank you.
I've got I've been a dentist for 44 years now. I graduated NYU in 1978, and the first 34 years or so clinical practice in New York, and the last 9-10 years mostly lecturing, advising startups. Now I've added in the last year, I added 2 roles. I added venture partner at Revere Partners, where we are the first venture fund that invests in early and pre-seed oral healthcare companies.
Yeah.
And also about a year ago, I joined Keystone Bio as their chief dental officer. That was, for me, working with Keystone Bio has the potential to really be a game changer for not just dentists, but for the way we look at and treat a lot of the major medical maladies that affect people. I mean, I think that the bacteria P.Gingivalis that's found in the mouths of over half of the adult population in an infectious state has been researched for over 70 years. But I don't think the answers and the true mechanism of how it works and how it causes these other maladies has really been aware. People, even in our own profession, don't understand it. The folks at Keystone Bio are doing a terrific job, not only understanding the process, but they have a treatment for it. So first, we should understand a little bit about what P. gingivalis is, or its full name is Porphyromonas gingivalis. For short, it's called P. gingivalis, or sometimes we'll just refer to it as PG. It's probably one of 2 of the most advanced bacteria that commonly afflict humans, the other one being H. pylori, which is in the gut. Both have evolved intricate measures to evade the body's normal immune responses, so they're allowed to carry on. The body's not able to keep them in check. And both have the ability to cause catastrophic maladies away from the local site. How that actually occurs has not really been truly understood until now. And among the general public, the word or the phrase P. gingivalis is, I would guess, unknown to virtually 99% of the population. So I'd like to, in the time we have today, discuss more about the mechanism of it, how it progresses from just causing local gum disease and gum destruction to causing major maladies of the body, including Alzheimer's disease, heart disease, diabetes, digestive cancers like esophageal cancer, oral cancer, rectal cancer, you know, and a whole host of other myriad diseases.
Yep. Yeah.
And,
Yeah, I did some research
and how the drug that Keystone Bio has in the pipeline can essentially really put the brakes on a lot of these diseases and lower the incidence. And since the therapy that we're proposing would be administered by dentists and hygienists, this stands to not only raise the busyness level of dental offices, but also raise the standing in the community to probably become the dental visit, become the single most important healthcare practitioner in the lives of many of the people in the world.
wow.
So
I can't wait to have you have the presentation where you show that this bacteria have linked to almost numerous of systemic disease that you're going to show. It is incredible.
okay, well, will you permit me to share my screen? It's currently disabled.
Okay, sure. Let me do that for you.
So while you're doing that, I'll give the folks a little background about what PG is. Let me see where I have my I know I've got the file open. Let's here we go. Okay. All right. Do you see the screen now?
Yep.
And if I click here, does it advance?
Yes.
Okay, great. So, you know, basically what we're saying here, you know, it starts in the mouth. And, you know, obviously this sounds drastic, didn't floss, and here's a patient in the morgue, but the reality is this is all too true. And I have seen in my own practice several very young people, I'm talking 30s, early 40s, with fulminating gum disease who chose not to treat their gum disease. And at least two that I can think of off the top of my head that passed away from heart disease prior to age 45. Crazy, right?
Right, right.
So these are common bacteria that are well, we've got spirochete, we've got Fusobacterium, we've got Treponema and P.Gingivalis here. P.Gingivalis on the right, you can see with its tentacle-like structure, which we call fimbria, which really lets it anchor into the gingival process. And these are known correlating diseases that have been linked to PG infection.
Wow.
Now, for example, in 96% of brains that from Alzheimer's patients that have been studied in autopsy, we have found the toxic protein or gingipain released by P. gingivalis in the brains of 96% of Alzheimer's victims. A very, very significant correlation between the bacteria P. gingivalis and gum disease. We know that the bacteria P. gingivalis itself mostly thrives in an anaerobic environment, an area that's very low in oxygen, such as the pockets in the gums underneath the gum line. And yet PG can exist in some folks without doing harm if they don't have gum disease. What happens is in gum disease, many of the bacteria that we saw in the previous slide coexist in what we call the biofilm. And PG is able to extract DNA information from these other bacteria and turn it into its most virulent and pathogenic stage, where it goes wild, releases the toxic proteins into the bloodstream that carries not the bacteria itself, but these toxic poisonous proteins throughout the body from the source of the infection, which is the mouth. We'll come back to that later when we talk about the therapy. So for now, we've got links to all these cancers, Parkinson's, diabetes, arthritis. I mean, this is a really mind-boggling list of what's what and who's who in terms of diseases affecting mankind. And of course, not to oversimplify, but of course, periodontal disease and peri-implantitis. So a therapy to remove and reduce and eliminate P. gingivalis starts by helping people with gum disease and prevents the destruction throughout the rest of the body that comes with it. This has an electron micrograph picture of a bacterial cell of P. gingivalis, and you see the arrows point to these outer membrane vesicles called OMVs, and there are many of them in the periphery of each single organism of P. gingivalis, and each of those contain the toxic protein or gingipains that, as I previously mentioned, have been isolated from the brains of Alzheimer's disease patients. So the researchers, and PG has been studied for like 70 years. There are thousands of articles in the literature about PG. The researchers have looked for the actual bacteria in the brain, but they don't, in most cases, they don't find any trace of the bacteria itself in the brain. And part of that is because of one of the major evolved mechanisms in humans that safeguard the health of our brains and our nervous system. And that's called the blood-brain barrier, abbreviated here as BBB. And the blood-brain barrier is generally impermeable to most bacteria. So it keeps our cerebrospinal fluid in our brains relatively sterile and bacteria-free. Of course, one major exception to that would be the meningococcal bacteria, which we know can, meningitis can be lethal within 48 hours and kill someone, because the rapid infection to the brain and spinal cord, causing extremely high fevers and swelling in the brain, can kill you very quickly. So what we have, and the other reason why PG won't survive well in the brain is because the brain has one of the most richly oxygenated organs in the body. It's the highest oxygen potential, location in the body. So being an anaerobic or oxygen-hating bacteria, PG would avoid situations where there's lots of oxygen. It would not thrive. But what we've found is that these outer membrane vesicles in the PG bacteria travel through the bloodstream. When they reach the blood-brain barrier, they increase the permeability, ultimately breaking through, and these toxic proteins get into the nervous system, where they wreak their havoc on the neuronal connections and cause, the onset of dementia that we're all too familiar with from Alzheimer's disease. And here's an example of how in the vessels, in the blood vessels, the toxic proteins cause smooth muscle calcifications, leading to narrowing of the arteries in the blood vessels and the resulting vascular diseases such as high blood pressure, heart attacks, and strokes. So I don't know how many follow the news about drugs to combat Alzheimer's disease, but last June, 9 months ago, we had a drug called Aduhelm by the company Biogen, was actually approved by the FDA against the unanimous recommendation of the advisory committee. And as a matter of fact, most of them resigned their positions immediately when the FDA approved this drug. And the drug name aducanumab, commonly referred to as Aduhelm, works by attempting to remove or minimize the beta amyloid plaques in the brain, which we have come to recognize as an indicator of Alzheimer's disease. The problem is the folks that have these situations where they've already got significant beta amyloid plaque or tau proteins in the brain are at advanced stage of Alzheimer's disease, which is not readily reversible. And there have been a number of drugs on the market, although this was the first new Alzheimer's drug in 18 years. There have been a number of drugs on the market attempting to treat Alzheimer's patients by minimizing or reducing beta amyloid plaque and tau proteins, and none of them have really been effective. So the need for another approach is there. And essentially what the approval of this drug does mean is that the FDA is saying that we are lowering the bar. We're going to lower our requirements, our regulatory pathway, that most drugs have hurdles to jump through to get a drug to market, which is good news for Keystone Bio. So right now, there's really only 2 companies on the market that had any approach that is non-beta amyloid or tau protein reducing. One of them is Keystone Bio, who has a drug that will actually eradicate the bacteria P.Gingivalis at its source, administered in gel form by the dentist or the hygienist. So right now, patients with gum disease come to us for periodontal prophylaxis, scaling and root planing, removal of subgingival calculus. I'm one of those every 3 months religiously. I've got my next appointment this Friday. And the reality is, unfortunately, that even when the dentist or hygienist does a phenomenal job of root planing and removing all the bacteria around the teeth, within 3 weeks, the biofilm reestablishes, P. gingivalis reappears, and the toxic proteins are circulating through our bloodstream to our body again. So even going for therapy every 3 months is only buying us about 3 weeks of PG-free state every 3-month cycle. So there is a need for a therapy that can eliminate PG, and Keystone Bio has one. There's another company out there that's public. Keystone Bio is private right now. More about that later, and about potential to actually, I'm looking to enlist dentists in my army to create awareness of the situation, create public knowledge about PG, and also, consider being missionaries to lecture to fellow colleagues and spread the word about that. And there are opportunities for my dental colleagues who want to take part in that role to also invest in the company, Keystone Bio, at this stage. They're currently doing a $50 million investment round, of which I currently have reserved roughly about $2 million in investable area for dentists who are looking to get involved in the effort to help me educate my colleagues and educate the public about the dangers, and just generally make them more aware of PG and how it works. So let me talk about the other company that's already public. Cortexine came onto the market about 1.5 years ago. They went IPO with a drug that is designed to attack the gingipains. in theory, a great start, because we know the gingipains, which are produced by the bacteria PG, ultimately do the dirty work of PG as they spread throughout the body. The problem is there are 151 different toxic proteins that the bacteria PG, releases into the body. Cortexyme's pill, it's not a dental treatment, it's an oral pill. Cortexyme's pill only attacks one of those 151 toxic proteins. And cortexyme's pill does not do anything for the local gum infection with P. gingivalis, which means that the body is still spewing, still has gum disease, and still spewing the toxic proteins into the bloodstream. And the pill is kind of fighting that spread throughout the body, but not getting the problem at its source. I liken it, I'd like to give an analogy here. Imagine that you live on the second floor in a building, and you go away on vacation and your sink develops a leak and a clog. And now your sink fills up and it's spilling water over the counter onto the floor. And you've got a flood going on and no one knows about it because you're not home. Well, before long, you've got a spill going through the roof down to the first floor apartment. So the folks on the first floor become aware of the leak, and eventually, something gets attended to. Well, if you look at the drugs that are available to clean up the beta amyloid plaque in the brain now, I liken that to mopping up the mess on the floor, on the first floor downstairs. You're just mopping it up, but really you haven't done anything about the flood upstairs, and you haven't done anything about the sink. So you're going to constantly have more fluid from the upstairs going through the roof onto the floor. What cortexyme's drug proposes to do is to attempt to mop the mess on the second floor. A little better, stopping it from getting to the first floor a little bit. But the reality is that only Keystone Bio has a drug that can actually fix what's going on with the sink and stop the problem at its source. So cortexyme drug still in the trial stage. They came out to market with roughly $100 million valuation. By the time I started following them last March, they were already up to $1 billion, which shows you how much the speculative value is of a drug that could potentially aid in just Alzheimer's, not to mention all the other diseases that Keystone Bio is targeting because of all the other diseases that P. gingivalis has been linked to. And the reality is that the trials were halted for a period of time on cortexyme's drug because they were apparently having some liver toxicity, some hepatotoxicity effects. And the CEO and the COO of cortexyme had some significant bailing out in their own personal stake in the company's stock. Not a good sign when the leaders of the company are bailing. Beyond all that, when Biogen's drug was approved last June, which signaling a lowered FDA approval process, that implied an easier pathway for cortexyme's drug as well. And their value on the stock market, remember they're a publicly traded company now, went to almost $4 billion without an approved drug, almost a 40x climb from the time of their IPO without even a drug.
Wow.
Crazy stuff, right?
Right.
Well, so their results came out for their GAIN trial. And the word GAIN is derived from a shortening of the word gingipain. So you've got the letter G and then the AIN at the end of gingipain shortens to GAIN. So the GAIN trial results were published at the end of October last year. And because of the fact that their drug only hits 1 out of 151 toxic proteins. And because the patients in the study, many of them had types of dementia that were not, related to PG infection. So the net result was that it was not statistically significant. There was no statistically significant benefit of Cortexim's drug. And now the bottom fell out on the stock. It went from trading over $100. It's down to, I think, $6 a share today. And the market cap is down to about $180 million. But the positive news is that within their trial, there's a segment of the study that you can look at that limits the focus only to patients with P.Gingivalis infections. And in that population of the study, be it a small population of the whole study, but in that population of the study, those patients during the trial either exhibited a halting of their dementia symptoms or an improvement in their dementia systems. Super encouraging stuff. And reinforcing the work that PG is doing to eradicate the bacteria at its source and the entire group of 151 toxic proteins. So, Oscar Fisher, one of Dr. Alzheimer's colleagues, was one of the first ones to suggest that an infection might be causative. And indeed, Keystone Bio had the lead article in the Journal of Alzheimer's Disease in August of 2021, last August, discussing the pathway for how PG bacteria, through its toxic proteins, enters the brain, disrupts neuronal activity, and is the culprit for Alzheimer's disease in many of the incidences of Alzheimer's disease.
Wow.
So, basically what we've got here, this diagram just shows how it starts with PG infection in the mouth, the toxic proteins released into the bloodstream. From there, they're transported to the brain, to the heart, to the liver, and you've got all these proven PG-driven neurodegenerative disorders like Alzheimer's and vascular dementia, Parkinson's, Down syndrome, and also age-related macular degeneration and retinopathy, not to mention other diseases of the body that are not neurodegenerative. So
that is scary.
But look at the research shows that periodontal treatment had a favorable effect on Alzheimer's disease-related brain atrophy.
Wow.
So the proof is there, and PG is the keystone pathogen in gum disease. So while periodontal treatment reduces pocket depth and the total subgingival biofilm, we cannot totally eradicate P. gingivalis. We can reduce it temporarily, and reducing the load of P. gingivalis does help a little, but it's not the be-all and end-all cure that we really need to get this under control. So, and plus there's additional research shows that PG infection induces the amyloid beta accumulation. So, while amyloid beta accumulation is pathognomonic of Alzheimer's disease, it doesn't mean that reducing it is going to cure these people. In fact, we've shown that it doesn't. So it's just what we call a biomarker. A biomarker is a measure of disease activity, a tip-off that one may be at risk for the disease, but it doesn't necessarily mean that being able to clear up the biomarker means that you're getting to the disease where you need to. So, this is basically just more literature here. The ApoE4 gene is the greatest genetic risk factor of sporadic AD, and fragmented ApoE proteins have been identified in the brain and cerebral spinal fluid of Alzheimer's disease patients. But they're saying that the protease, or the agent that is responsible for fragmentation of ApoE is unknown. But here in this study, it has been shown in this particular study here that it is the gingipains, the toxic proteins of P.Gingivalis that cleave the ApoE proteins, and really explain in detail that we've never had before how this mechanism and process works. So here's some articles again about that drug Aduhelm from last year, how an unproven drug got approved. Basically, good news, there's this sharp rise in Aduhelm and parent company Biogen stock in June of last year, went from 270 to over 400. Other companies, Cortexime on top, shot to well from its levels in the 30s, went to well over 100. Now that stock is $6 a share. So, the bottom line here, to summarize, is that Keystone Bio has the only precision biologic on the whole planet that's shown to eliminate the toxic proteins at their source. And where are we now? There was actually the safety and efficacy, which is phase 1. We expect it to be a breeze because essentially the safety and efficacy has already been carried out. There was actually a trial in the UK in 1995 testing a precursor form of KB's drug that was actually shown to eradicate P.Gingivalis for up to a year. The problem is the researchers were looking for a one-time cure. They were looking for a one-time permanent cure. And when it came back, even after 9 months, I don't think they realized how powerful a weapon it was. So the funding was withdrawn. The researchers from the Keystone Bio team, led by Dan Sindelar, who's a dentist, and one of the original founders of AOSH, the American Academy of Oral and Systemic Health, I believe in the late 1990s, almost 25 years ago, discovered this work. Dan assembled a team of some of the most amazing vaccinologists, virologists, microbiologists and cardiac specialists onto his team, and they have the IP, the patents on the intellectual property. They've made some changes. It's a monoclonal antibody, and basically, because we know about safety and efficacy from the tests done in the UK in 1995, we expect phase 1 to be relatively smooth sailing. Phase 2 and 3 is where they break down the study into more specific groups, like people with Alzheimer's, people with, early heart disease or digestive cancers or arthritis or whatnot. And it's necessary to have trials on each particular malady to make a claim for those specific maladies. But obviously, we'll go first after the Alzheimer's disease because that's the biggest bang for the buck. So where are we now? We don't have the drug now. It's not going to be available. We know that people go to the dentist. We know that periodontal disease affects 50% of the population over age 30, 75% of the population over age 65. And people will have a treatment plan. Some of them will accept it. They'll go through some perioscaling and root planing. They'll be told by the dentist, hey, we don't cure your gum disease. We're just co-partners with you. You need to brush and floss properly. You need to also understand that there are going to be deposits of bacteria that are going to reaccumulate, and it's essential for you to come back every 3 months. How many patients actually follow through with that? We know a much smaller population than we would like, from my own personal experience. Few patients really regard it or see it as a threat to their lives, or that not coming back for this periodontal treatment that they need every 3 months is going to cause them to have heart disease or Alzheimer's or diabetes or digestive cancer. They don't see it. They're not convinced about it. There's a company out there, Bristle Health, that sells a direct-to-consumer kit that you can get a tube, you spit into the tube, send it back to the company. I did the test. This is what I got back. Came back that I'm at relatively high risk for gum disease, about 6.5 on a scale of 0 to 10. And my PG is off the chart, 9.7 out of a maximum 10. That's really bad news for me, especially since I've had gum disease for a while. And while I go religiously every 3 months like clockwork, I know that my PG is going to be back in 3 weeks after the scaling. My mother passed away of Alzheimer's disease 18 years ago. So I am, definitely a candidate for this and can't wait for this therapy to be available to try. I want to line up to be patient 1 for this stuff.
Amen.
So we can do salivary testing on our patient and explain to them or identify their PG levels. We can say, hey, look, you've got this. And we can also do before and after salivary testing. So like have the patient collect a sample at the time of visit or do it at home right before their professional visit, and then have them repeat it again like a few days to a week after treatment, and they'll see that we've knocked their PG levels way down. That's a powerful marketing tool that we can use to convince our patients of the need to make sure they come back for regular treatment. And by educating them about the awareness of PG and the dangers of PG, we'll have them clamoring, and not only to come back at regular intervals, but asking us, hey, doc, when is that PG drug ready? I want it, let me know as soon as it's ready. Approximate profit motive for the dental office of PG treatment, probably about $500 on top of the cost of scaling and root planing. So not only are we doing good, but we're doing well. We're keeping our patients healthy, treating their periodontal disease with the latest treatment possible, but at the same and also preventing them from developing these dangerous diseases, and then also doing well financially in our own practice by adding this treatment regimen. And as you can see here, this is not, we don't know yet the format, but presumably a blunt irrigation needle delivering the liquid into the pockets after the scaling and root planing is completed. So, in conclusion here, we'd like to, I already discussed Cortex-Simon and the GAME trial here. So the GAIN trial did confirm that PG in the mouth is the cause of a large subset of Alzheimer's disease. 30% to 40% of adults walking around have PG and are unaware. So it's a huge market opportunity. We're talking about a significant part of the population. And then investment potential. So while, obviously we can't make any recommendations on any companies here, including PG. Any investments in companies that have drugs merely in the trial stage are going to be speculative and carry risk. But at the same time, the potential therapy here, both, just for adding the therapy to our regimen, um, is huge as a game breaker. Even if we, in the 3 years or so before this drug gets to market, we can immediately increase patient demand for periodontal services in our office. And if we incorporate the therapy afterwards, further financial gain. And if you look at a drug like Cortexine, which saw a 40x multiple without even a successful product, you can only imagine if this product is successful, what the multiple on return on investment could potentially be for it. The numbers are astronomical. So
Absolutely amazing, Dr. Zuckerberg. It is amazing to hear this latest information and research about Keystone Bio. How I see it on the company. There's a few dentists, scientists, microbiologists, and they work hard. And hopefully, this is gonna breakthrough for the entire earth. At the dentist, I go in, I work on the patient, do cleaning, do gum surgery, and sometimes I feel my heart saying like, I'm doing it, but if you don't take care, you're gonna get it again, and I feel the suffering, but now I hear the news that there is some drug that can eliminate the gum disease for the patient. Not just gum disease, but we're going to help so many medical specialty for their treatment. And this is just so amazing. It's so powerful that how much dentists can have a playing a role at the healthcare provider, and not just treat the gum, but healing the whole body, improving the whole body. And this is just, especially you're talking about Alzheimer disease.
People have said to me, how many people are going to be able to afford two $500 treatments a year to go to the dentist and get this magic medicine? The answer I have is, how can you afford not to if you have PG gum infection? So also in the pipeline, Keystone Bio also has a diagnostic that will be able, the dentist will be able to take a sample of the patient's saliva and determine if this is an at-risk patient who should be treated. We never want to do excessive treatment. We don't want to deliver medication and create an unnecessary expense to someone who's not a candidate. Not every patient with gingivitis or early periodontitis is going to test positive for PG-driven periodontitis. So we will be able to identify the at-risk patients and know that we will only treat the patients who need this therapy. In addition to that, when we go to insurance carriers, the costs of paying for medical insurance for Alzheimer's disease and heart disease and cancer and diabetes and whatnot for insurers are astronomical.
Absolutely.
So if we can show studies to the medical insurance companies about how we can save them tons of money on medical expenses, we hope that this particular therapy will be something that will be billable to medical insurance and reimbursable by through medical insurance, where patients' reimbursements are traditionally much higher than dental insurance.
Absolutely. I get, this is the breakthrough for dentists. It seems like, we used to do it. We do a referral to the cardiologist, referral to the family physician for medical consultation. But in the future, some of those medical specialty may need to refer back to the dentist too. for us to take care.
Absolutely. I mean, the first line for any physician, for example, who treats a patient with diabetes, is to make sure they go to the dentist first and be identified. If they've got periodontal disease, they've got to get their periodontal disease treated. And if there's a drug to eradicate PG, they're going to make sure that's done first. And
Absolutely.
oftentimes that'll turn a severe case into diabetes and one that can be controlled with diet.
Absolutely. There's so many medical disease, the condition, systemic disease that you listed there, and even like it's related. I read the article. It related to people who have let's say male and female, they have oral sex, and they transfer the bacteria, the P. gingivalis, into the woman area, and now she got the infection in there. And it's just bad, or pancreatic cancer by PG, P. gingivalis. All those conditions that we if we keep talking, they just related to the mouth. Everything starts with the mouth, It's this is something that is I am so excited and so hopeful that the future is gonna be bright for the world, for this earth, because everyone, like you said, 70% to 80% of adult population suffer from gum disease, and majority of people are unaware of diabetes problem, and it's cardiovascular disease, arthritis, and Alzheimer disease, and Parkinson. You name everything, it just related to P. gingivalis.
Right.
And Dr. Zuckerberg is a wonderful news, and hopefully we, the dentists, I encourage other dentists to follow Keystone Bio, and if you have questions for Dr. Zuckerberg, he's gonna leave his information at the end of the podcast, and please share this news to your patient, because right now we're not just taking care of the patient in the mouth, but in the future this is not only just for the patient. In the future, as we get older, we're gonna have arthritis, we're gonna have diabetes, we have Parkinson, we're gonna have Alzheimer, we're gonna have stroke, heart attack. It will come in, and if we are aware of this, we're not taking care of our patient, but we're gonna take care of us in the future. This is incredible, Mr. Zuckerberg. Incredible stuff.
People who want more information can message me either on my Facebook page, Painless Social Media, or on my website, which is painlessdrz.com.
All right, and also because this podcast, when I post it in the internet, there's patient may ask, like, what's going on here? Dr. Zuckerberg, for your 40 years, 50 years of dentistry, would you give the patient, the general population, some few advice of the oral health, and how what they should do? What are the tip or prevention or care that they necessary to do for themselves daily or monthly, yearly, in terms of their oral health? Would you give them some advice?
Well, it all, as far as periodontal disease, which is the number one affliction and the number one cause of tooth loss in the world, it all boils down to plaque control, right? So a toothbrush alone doesn't do the job fully. You've got to do some form of interproximal cleaning, either dental floss. I love the soft picks. Unfortunately, I've got some big spaces between my teeth, which comes with age, and the soft picks work really well for me. Some folks like water flossers or air flossers, anything to remove foodstuffs that can get stuck in between teeth. And then when it comes to diet, of course, reducing acid producing foods, high sugar foods, which we know are not healthy for the teeth and gums, and also minimizing the number of times a day you eat into meals. Multiple snacking means multiple times during the day where the mouth is bombarded with acidity. Any food, even healthy foods, are going to increase the pH, make the mouth more acidic. And the more times a day you're snacking, the more your acid level in your mouth is departing from a neutral pH. So, and then of course, the realization that no matter how well you do with good eating and home care at home, there's always going to be deposits that accumulate that you can't remove yourself. So don't forget about your dental professional. Your dental team, including your dentist and hygienist, needs to perform prophylaxis on a timely basis that they will usually tailor to the needs of individual patients. For some, it's twice a year. Some may need more, 4 times a year. Some may require less, but on average, twice a year. So if you've got gum disease, certainly 3 to 4 times a year.
Absolutely, I agree. Dr. Zuckerberg, thank you so much for your time today. I look forward to share this on social media and to the other college, other dentist friend, new graduate, and we're gonna follow the Keystone Bio and also follow your page to spread this word out, and hopefully good news will come along for Keystone Bio and your work that you have done for nationally and internationally with so many information that you have shared. And this is one of the powerful information that is just wonderful to hear. Thank you again for your time. I am honored to have time with you today. You have a wonderful day.
Thanks for having me on. Take care.
Take care.